2 hours total.
Total. Ethan went in, was seen very professionally, very efficiently, very quickly. It took a matter of minutes for his filling to happen.
Minutes for the filling itself. Wow.
Now, compare that to the UK experience they mentioned earlier. The parent didn't hold back. Quote, "Whilst we was in the UK, the process and the amount of time that it took was ridiculous."
Ridiculous, that's a strong word. It really speaks to the level of frustration they must have felt before.
It really does.
And this whole story, it just powerfully illustrates how different systems might prioritize different things, right?
The Chinese experience here seems heavily weighted towards speed, efficiency, cost effectiveness, at least for this procedure. And for a patient needing a quick fix, that's a massive relief.
You can hear the relief in the parent's voice, describing the professionalism relative to the cost as incredible.
Yeah, the sense of gratitude, that feeling of problem solved efficiently and affordably. It shows that low cost and speed can go hand in hand with a positive patient experience, at least in this case.
So, wrapping this up, what does this all mean for you, listening? This deep dive, it's given us a really close look at how a simple dental problem can spark this journey across continents and reveals these huge differences in cost, speed, and how the patient feels about it all. It's quite a story of finding a solution where maybe they didn't expect it and at a price that clearly amazed them.
It brings up that important question, doesn't it? When you think about your own healthcare needs, what parts of this story resonate most?
Yeah, what stands out? Is it the speed, the low cost, the feeling of professionalism? What do you see as the most desirable thing in a medical situation? Because every system has its trade-offs, its strengths. And this story really highlights how one system's particular strengths, in this case, maybe efficiency and cost, can be exactly what a patient needs at that moment.
And maybe a final thought to leave you with. How much of our idea of good healthcare is really tied up in things like speed and cost?
Versus other things.
Yeah, versus things like maybe the initial diagnostic accuracy or having continuity of care with the same provider, or even just the cultural expectations we have around getting medical treatment.
Good question.
And how might one single really positive experience, like Ethan had in China, change how we view healthcare systems globally? Does it make us look beyond our own borders more readily?
Definitely food for thought. How much does one anecdote sway our perception of vast, complex systems?
Something to mull over. We'll leave you with that until our next deep dive.